During today's video, we are going to discuss the importance of vitamin D, and I will go over just some of the signs that we as women may not be getting enough of.
And there was quite a lot of people there actually, and like more people.
You know, vitamin D is probably one of the most researched vitamins in the world of medicine, as it is considered necessary for the human body, as well as it being one of the most talked about, especially when it comes to protecting our immune system during cold and flu season or when talking about the health of our bones. But vitamin D is more than that. That's just the tip of the iceberg. What is really fascinating is that vitamin D is referred to as the sunshine vitamin. Well, actually, it's a hormone, and yet our body naturally produces it when our skin is exposed to natural sunlight. And what is even more interesting is that it has the ability to affect different organs and tissues throughout our body, as there are vitamin D receptors located in just about every cell in the human body. And one of its key roles is to assist in the absorption of other key minerals such as calcium, phosphorus, and magnesium in the body. Ladies, this is important because you need all of these micronutrients for you to be able to build and maintain a healthy body, literally from head to toe. Your brain, your heart, your lungs, your colon, your liver, the list goes on. So, what could happen when you are not getting enough of vitamin D, whether it be through the lack of exposure to sunlight, or you are not consuming enough vitamin D enriched foods, or you are not taking any supplements? Well, let's go through just some of the body parts that are influenced by vitamin D, and then we will talk about some of the signs that you may be vitamin D deficient. But before we do, be sure to click that subscribe button and the notification bell so that you will be notified every time I release a new video. So ladies, let's begin with the hair. Vitamin D is great for the hair, but if you are not getting enough of it, your hair could become very dry, it may begin to thin out, it may become brittle and easily break off. You may even notice that your hair may not grow as fast as it used to because hair growth is dependent on vitamin D, as it helps in stimulating new and old hair follicles from which hair can grow. Furthermore, when assessing the health of your hair, you should also pay attention to your scalp, especially if you are experiencing areas of redness, itchiness, tenderness, and excessive flaking, which you might automatically assume is dandruff, but in reality, it could be a sign of vitamin D deficiency, as it has been linked to scalp disorders such as eczema, psoriasis of the scalp, as well as alopecia, which is an autoimmune disorder where there are patches of hair loss throughout. Quite often, ladies, vitamin D deficiency is not even on the radar of many of us women because we think our hair problems may be due to issues as the shampoos or conditioners, the types of brushes or hair dryers you are using, our thyroid, stress, or age-related changes as when we go through menopause, and totally not thinking that it could be a vitamin deficiency issue either by itself or in combination with those other issues. In a nutshell, when it comes to the health of our hair, what's happening inside of your body, including what you put in it, carries a little bit more weight when it comes to producing healthy hair than what you put on top of it. Important point, while vitamin D is very important, make sure you are getting enough vitamin A, vitamin B, specifically biotin, and C, as they are important for the health of your hair as well. Now let's discuss the brain. Vitamin D can work wonders when it comes to our moods. But what happens if we are deficient? Well, let me give you an example. What happens to many of you during the winter months, or if you are one of those individuals who reside in northern climates where you just don't get a lot of sun, or if you are one of those individuals who like to shun the sun? Well, not being exposed to natural sunlight, you may not be getting enough vitamin D naturally. And if you are not eating the right foods or supplementing with vitamin D, you could be at risk for developing anxiety, bouts of sadness, depression. And not only does that affect your mood, it can also affect your memory. We can end up developing this kind of brain fog because being deficient in vitamin D also influences the cognitive part of your brain. It's that area of the brain that helps with memory and the ability to concentrate. Let's look at another body part, which would be our reproductive organs. When I mentioned earlier that there are vitamin D receptors throughout the entire body, that includes the uterus and ovaries as well. And for those of you who are or have been pregnant, just so that you are aware, there are vitamin D receptors on the placenta as well. And it leads me into a discussion of our menstrual cycles, as there are various international studies that have suggested a link between being vitamin D deficient among women who experience irregular period cycles and those who have been diagnosed with PCOS, also known as polycystic ovarian syndrome. What many of you may not know is that if you take in adequate amounts of vitamin D along with calcium, both can assist in the healthy development of ovarian follicles in the ovary, resulting in ovulation, which is essential for you to have a regular period. But when it comes to being diagnosed with PCOS, what is worth mentioning is that the criteria that makes up PCOS, including insulin resistance, menstrual irregularities, infertility, and excess androgens such as testosterone, have all been linked to vitamin D deficiency. Now, these studies are not saying that vitamin D deficiency is the cause of PCOS, but what these studies are suggesting is that if you have the diagnosis of PCOS and you are vitamin D deficient, that it actually make the symptoms associated with PCOS much worse. Now, let's look at vitamin D and see why it's great for our muscles, our bones, and joints. Beginning with the muscles. They need vitamin D because vitamin D controls calcium, and calcium is involved in the contraction of your muscles. For example, many of you who exercise, if you are vitamin D deficient, you may not recover as well as you may begin to experience muscle cramps, spasms, muscles that ache or are very weak. I know that many of you assume that it may be related exclusively to your electrolytes, but that may not always be the case because it could actually be vitamin D that helps you absorb the electrolytes that is actually the problem. This actually helps to explain why orthopedic surgeons and many fitness instructors advise their clients to either consume foods rich in magnesium or take magnesium supplements, or some who would even suggest soaking in Epsom salt baths, which is high in magnesium, after an intense workout. This is perfect because vitamin D and magnesium work together. They actually need each other to work properly. That is why when we physicians are checking vitamin D levels, we are also looking at your magnesium levels as well to make sure they are normal, because if they are not, your vitamin D may not work that well for you. Any discussion regarding vitamin D is actually incomplete if you don't discuss magnesium, as magnesium helps the muscles relax after a workout, which counteracts the role that calcium plays in contracting the muscles during the workout. And just as an aside, we use that same logic when it comes to period pain. That is why you see many of us OBGYNs and other medical practitioners recommend magnesium supplements along with vitamin B6 and vitamin D3 for women who are experiencing menstrual cramps, as it helps to relax the muscles of the uterus. If you are an individual who suffers from joint pain, stiffness, inflammation, especially those who suffer from such conditions as osteoarthritis and rheumatoid arthritis, vitamin D can help, as it is considered a very potent and natural anti-inflammatory, and it helps ease the pain. Moving on to bones. When we talk about vitamin D and the bones, we know how important it is because vitamin D helps the body absorb calcium in order to build strong and healthy bones. But what happens when we are not getting enough? Well, we can start experiencing bone pain in certain areas of the body. For example, some of you may begin experiencing pain in places like the breastbone area, which we call the sternum, or certain areas around the rib cage, the lower back, or even the areas of the shin, that if you touch these areas gently, they could produce pain. Now, if you are vitamin D deficient, you may be at risk of developing softening of the bone, as well as bone pain. You see this in conditions that is called osteomalacia, which is actually more common in women, especially those who are pregnant. With this condition, you could see bones that break more easily, particularly bones located in the hips, lower back, and the feet. You may even have difficulty walking, and you may even change the way you walk, possibly with a little waddle. If you are vitamin D deficient, you can develop osteopenia where the bones may become a little weaker and they can begin to thin out. Or you can develop osteoporosis where the bone starts losing bone density and you are prone to breaks and fractures. I hope that you found this information helpful and that you have a better understanding of why vitamin D is so important. Thank you for watching. Bye.